Greetings once again. It's a pleasure to be back and it's a pleasure to have this conversation with you. So, today, as promised a week ago in my LinkedIn profile, I ventured actually and endeavored to ensure that I deliver a series of discussions. And these discussions are around the new public health order. That is the commitment and the call to action that the Africa CDC has committed to ensuring that we drive a robust agenda as a continental front towards ensuring we have secure public health systems, and at the same time we ensure that every African, wherever they are, is able to access the quality healthcare services and solutions that they need to ensure that they live healthy lives, whichever place that is. So when you look at this for today, I'm going to talk a little bit on the point of how do we mastering the new public health order. Mastering that new public health order is about one, you need to understand what are the key pillars of this particular new public health order, how does it come around, what do we ensure that we achieve to ensure that we get to that point, and what are some of the prerequisites. In that case, for me, it's about what are the shortfalls that we're having, what are the kind of interventions that need to be implemented, and once these interventions are implemented, how do we ensure then we make them be sustainable towards the foreseeable future that we hope for. And that foreseeable future is we have an African pharma healthcare industry that is actually robust enough to stand alone on its own to deal with pandemics and disease outbreaks that might arise anytime, in any point in time, and ensure that every African, wherever they are, is able to access the quality healthcare services without suffering financial hardship, and that is the principle of universal healthcare coverage. So when I look at it from that standpoint, then we started in the sense that this call to action was officially launched on 21st of September 2022 last year. Then after the discussion that had been coming behind that, we ended up having the conference on international public health in Africa that happened in December in Kigali, Rwanda. And that is the point that actually this new public health order gained momentum and it became a continental conversation and a global conversation with different entities and organizations looking at how do we play a role in this, what are the next frontiers, what are the next steps. And for me, that is not most critical. The most critical bit is this is a commitment by the African Union heads of states and under the umbrella of the Africa CDC, which is the public health institution that's driving health intervention and pandemic preparedness and response in the continent. So when we look at it from that standpoint, then we need to ask ourselves, what are the key imperatives to ensure that we achieve all that is envisioned? And what is it that has been envisioned? This particular new public health order envisions 5 particular pillars. 1, strengthening institutions of public that support public health in Africa. When we look at it from the public health institutions, I think one of the key bits that we normally lose focus on and actually lose the grip is the sense that we look at public health institutions as just public health institutions, or let's say, for example, the National Institute of Public Health in Kenya, the Kenya National Public Health, or such kind of initiatives. So that is good, yes, but how many other public health institutions do we have in Africa? From a national standpoint, we have every organization. We could talk about from the NGOs that are working in public health, from the ministerial agencies and government agencies that have been established. For example, in Kenya, we can talk about Kenya Medical Research Institute. We can talk about the National Public Health Institute, that is the Kenyan one. We can talk about any other agency. We'll talk about, I think, KEMRI would be key, but other than KEMRI, you can talk about the National Public Health, the parastatals like the NTD's department under the Ministry of Health, Ministry Department on the cancers generally. So all these agencies are promoting a public health intervention and need in their local communities. And even the Ministry of Medical Services, Ministry of Public Health, and all this kind of intervention. But across the continent, we have multiple agencies that are addressing public health. But not only those. One other key thing that we need to ask ourselves, public health is not just about the people who are offering the services of the community, but what are the key drivers towards public health? And some of the key drivers in this particular moment for me is, 1, we have access to essential medicines and supplies. Which organizations are responsible for ensuring these medical supplies are available? From a continental standpoint, I think if you're talking about strengthening African institutions that are working to promote public health, we need to start from Africa CDC. What are the prerequisites? Last year, but when we had this particular decree by the AU heads of state where it was given autonomous mandate to drive public health interventions and actually pandemic preparedness, which is a good thing on its own. But that doesn't happen in isolation, and therefore it means we have other agencies that need to be strengthened. One of them, the Africa Public Health Foundation. How is it moving forward? What are the gaps that are existing? We have Africa Medicines Agency, AMA. Currently, we are talking about a continent of 55 member countries, and less than 30 have signed and ratified that particular treaty. What commitment are we having as a continent towards the new public health order, if even a particular treaty, signing of a treaty and actually ensuring we have the legal documents to ensure it can move to the next frontiers is not happening? So who signed the new public health order treaty to actually commission and endorse it within Africa CDC, if not the real leaders who as well at the same time are supposed to be signing this particular treaty on AMA to ensure regulation of medicines and essential health products is harmonized across the continent? That is a critical bit we need to ask ourselves. Africa Pharmaceutical Foundation, established in December, it is to be based in Rwanda. These are conversations. What are the key challenges? And for me, the main bit when I was talking about looking at this particular topic was public health institutions need to be strengthened. But those institutions can even be in the form of agencies and interventions and programs that have been designed. On the backdrop of COVID-19, we had a jolt, and that jolt actually got us to do a lot of stuff. And this particular intervention that we are implementing, including the establishment of the Africa Medical Supplies Platform, it was a good idea. But how are we supporting them? What are the success metrics? What are the achievements? What are the gaps that we are seeing? How do we move it to the next frontier? And I think those are some of the conversations that we need to start looking at and to ask ourselves, are we honest about this kind of conversation on having new public health order or not? Because if we are serious about it, we need to start by interventions, program, heads of state ratifying treaties, and making commitment to resource these particular institutions, because without the resourcing, it can't happen. And resourcing is not only on monetary terms. Resourcing entails even the human workforce and the capabilities and the political goodwill as a resource to that future. The other thing is that of strengthening of public health workforce. And one of the key bits that is of interest to me is that from an African standpoint, whenever we talk about public health workforce, most of the focus goes to community healthcare workers, and even in the particular call to action, it's about how do we ensure Africa has sufficient number of community health workers. I think that is kind of a myopic outlook, and it's kind of redundant in the sense that we are looking at community health worker with basic training in terms of dispensing the lowest cadre of care in a community setting. I'm not against the fact that we need community health workers and actually they're doing amazing work. But the question that I'm asking myself is, what happens when they're able to intervene and facilitate a referral pathway, and there's no physicians or pharmacists or nurses in the primary healthcare facilities where they are referring patients? How do we intervene in that kind of situation? So when I'm looking at it about ensuring we strengthen the public health workforce, it's about one, acknowledging and establishing the metrics on what are the gaps in our health workforce. Currently, we have most of our countries in Africa training healthcare workers, but after the training, a majority of these people are actually leaving the continent. As a pharmacist, I know how I engage with some of my colleagues, and people are looking at how do I get an opportunity to get out of the country. So if you're going to invest in training and training people who are going to leave the country, then of what value is that investment for us? And it's not that they don't want to work internally. They want to work in our continent, but they lack the opportunity and the avenues to deliver that. And therefore, they are looking at what other prospects exist for them. So when talking about ensuring we strengthen the public health workforce, let's ensure the community health workers are there. Yes, they are well trained and equipped and actually remunerated enough to be able to deliver that work through incentives that are in place. But at the same time, the referral pathway depends on qualified healthcare professionals. And in qualified healthcare professionals, let's determine the numbers of people who are needed. One, in particular specialization that are needed. Then the next phase from that is, do we train them? Do we employ them? Do we retain them in the healthcare system? If we don't do that, we are losing. And that does not only entail with the initial training at, let's say, for the undergraduate level. Masters, specializations are needed. And even in practice training. How do we ensure that a pharmacist working in a community pharmacy can be able to intervene in the local community context through robust training and enabling of their service delivery to ensure they are partners rather than letting them be working as silos and within the healthcare system? So that segregation has to stop. That would be important for us, and we need to focus on public health workforce across the continent, from the community health workers to the highest level of specialization. Because if we don't look at those specializations, there will be a gap, and that gap will never be met by a community healthcare worker. And the other thing that I feel needs to be adopted now as we're moving forward, community health workers, yes, at the community level, but we have specialists and physicians who have been trained and actually qualified that are not getting the jobs. Other healthcare workers, from nurses, physicians, clinicians, pharmacists, pharmaceutical technologists. Why don't we engage them at the community level to apply their advanced specialized training and actually delivering the primary healthcare services? it will be ensuring that we have more of the intervention being tackled and addressed at the local community level, and that would be a win in my perspective. So that is something that we need to look at. The other thing we look about expanding local manufacturing in Africa, pharmaceuticals and healthcare products. I think there is a conversation that has been there from 2009 or thereabout, when we had the pharmaceutical manufacturing plan for Africa. Unfortunately, we are not moving fast enough to ensure that this is realized. The reason is we are not consolidating our markets. Africa Continental Free Trade Area came into place. Have we consolidated our markets where we can buy in volumes and incentivize local production? Because economies of scale are essential. And when we have disparities in our local requirements and local markets, then there's no substantial incentive for investment in that industry. We need to look at that. Another thing around local manufacturing is ensuring we have the sufficient workforce, we have the resourcing, and that is where governments in Africa can actually support by offering land, because land is one of the greatest resources of production, and if we're not having sufficient land to do that production, they're not going to move forward. And then rather than that, we now look at it from a trade perspective. Can we facilitate the exchange of information and knowledge? That is tech transfer, we're looking at it. How do we come around on that? So tech transfer, human workforce development within the pharmaceutical manufacturing, regulatory harmonization and streamlining of regulatory processes, including the good manufacturing practices, to ensure that we are guaranteed of having quality products being generated, produced and made accessible in our local context. If that is in place, we consolidate our markets, we have an agreement and an engagement on how that moves forward to the next frontier, we'll be in a better position. But if we just keep talking and developing position papers on how we can strengthen local pharmaceutical manufacturing without doing the actual work, then we're losing it. The next thing is we need to have our governments incentivizing investments either locally or from international partners to ensure that there's an enabling business environment. From a Kenyan standpoint, we're already complaining about the cost of production in terms of energy, workforce costs, and even training that we need to go through, the land costs and all that. So these particular barriers, taxation and actually high tax regimes, when the tax regimes are not favorable, then it means the cost of production also goes higher. That cost is going to be transferred to the patient, because it's a business, it has to break even and actually generate some returns on investment as a profit. So how do we balance those? And I think those are kind of considerations that we have to make as African populace towards achieving the new public health order. The other thing, we have to increase domestic investment in health. One key thing that has been amazing to me is the fact that we've been talking about ensuring improved investment in health and all that. The budget declaration, 15% of government expenditure. None of African countries have ever met that target. How do we move to ensure that we're able to stimulate domestic investment? And domestic investment, one thing is, it's not only government investment in health. Domestic investment involves even investment at an individual level. Am I having a health insurance scheme? Because that is my personal investment in my health. How many of us are doing that? And we need to drive incentive from a service delivery standpoint, but also a value proposition in terms of what we need. And if we're able to establish that, we'll be able to move forward to the future that we're hoping for, because that investment, it is me as an individual investing in my own health, me as an individual investing in an institution that will guarantee my health. And that is where we're talking about community-based social insurance schemes, where we can ensure that the financing that is pooled can buy equipment, can resource facilities, can construct facilities, and actually facilitate remuneration for community health workers who are touching on the lives of the local communities where we operate in. So that dynamic has to be in place, and we have to ensure that there's a balance that is being met, and that domestic investment is critical. Currently, actually, to a greater extent, you'll find that the development of partners and NGOs have been funding the greatest proportion of African public health costs, or even the healthcare costs. So if we already, most of our cost is being run by another person, how do we talk about dignity, autonomy, and respect if we are not even able to take care of our basics? I think those are some of the conversations that we need to have. However much they might not be that appealing, but something needs to be done, and that is about us taking responsibility and moving to the next level. The last thing is about promoting action-oriented and respectful partnerships. I think it's time for action, and it's time for action not only in terms of talks and all everything that we're talking about. It's about us to take action and see what are we doing. Are we investing? Or do we want to keep talking about policy reforms, changes that we need for the next 30, 50 years? That is not going to be the ultimate goal of Africans. We need to start by doing what needs to be done with the available resources in our local context. And that means, can you design an intervention in your local community? Can we partner with the local healthcare professionals? Can we partner with the local pharmaceutical industry to ensure that we stimulate local development of the sector? Then beyond that, we need to ensure that these partnerships and relationships are enabling towards that future by doing what needs to be done. And when talking about respectful partnership, one thing is Africa has been looked at as a continent that needs more help rather than an equal partner. And it's because of the level of which we've been playing. And I think this has to change if we really need to drive growth and development in the African healthcare space. And that is the sense that as an African, how do I respect myself if I'm going to talk about our stories in a negative light? And it's annoying in the sense that you'd find there are gaps, yes, in our healthcare system, but those gaps need to be addressed, and you know how what can be done. Yet you're not doing it, but rather seeking more and more help without looking at what are you offering in exchange for this particular help that you're asking for. I don't think from an African standpoint we need to stop being beggars but become acting as allies and partners who are working towards a common future. And that common future is a common future for our people. Nobody has the responsibility to provide for us, but rather we need to fight for ourselves and provide for ourselves and seek allies that can help us achieve our aspirations. Ultimately, as members of the human race, we have a common aspiration to ensure we have a healthy populace and a healthy global continent. In that case, then, if we are able to work towards that commonality driven by our own visions, our own aspirations, then we're able to bring partners. But if we are waiting for the externalities to actually inform what we're going to do and whether we're going to do it, then we're going to lose it. And this particular moment is the COVID-19 brought us to where we are, where we thought actually we now need to do something. I don't think we need another pandemic to do that. It's upon us to start working, to start moving to the next frontiers. And if we do that, we'll be on a better case. And I think this gives a brief background on what we're looking at. In the next series of conversations, I'll be sharing more about each of the pillars and each of the pillars in terms of what can I do as a professional, what can you do as a pharma company, what can you do as an investor at a financial institution, what can you do as a young person, and how do we hold our leaders accountable? Because at the end of the day, they have a role to play in making these things realities. But at the same time, as an individual, there's something that I can do that doesn't really necessitate bringing on board stakeholders and actually government leaders. So that is how I'm looking at these particular dynamics and imperatives. And if you're able to move forward, then I think the new public health order might become a reality. But unless we do the work, it will just be a story that we tell and a commitment paper that we have on our websites and our different archives. But at the same time, it won't be giving us the results. So I'm hoping we make action and move to the next frontiers. Thank you so much. If you enjoyed these conversations, subscribe to the channel, share with your colleagues, watch, and let's see how the conversation keep moving. If you have a topic that you want me to talk about, please share it with me in the comment section and let's have the conversation moving forward. Thank you so much, and let's engage next Sunday.